Well, welcome everyone. You got it all? Just hit that button or hit the
Excellent.
screen.
Excellent. So my updated presentation isn't here, but there's just a few minor changes. I am Dr. Laura Griffith. I've got my Bachelor of Science in Nursing, my Master's in Business Administration, and my Doctor of Nursing Practice, which I just received from the University of South Carolina last semester. And I am a nurse executive. I've been working the past 5 years for the South Carolina Department of Mental Health. And I want to make a couple introductions first. First, I have Diane Taylor. She is also a master's student, and she is working on her Doctor of Nursing practice at the University of South Carolina as well. And I'm going to have Diane talk to you. She is an informatics nurse manager, and I want her to tell you a little bit about her job. And then we're going to have Aiden speak for a few minutes, and then I'm going to do an overview for the Department of Mental Health, job opportunities that we have, and any tips for interviews and careers for NIT. So starting with Diane.
Hello, thanks for paying attention to us today. Just wanted to let you know that my background, even though I'm a nurse, nurses can do a lot of things. And I got involved in the IT aspect, using the liaison between nursing and IT. When, if you recall, Y2K came along and the world was going to end. And we had a homegrown electronic medical record, and all it could do was enter orders for the laboratory and the radiology department. So when Y2K was coming and we needed to get rid of that, that was something that was already approved. We went with Cerner, and I became the point person for the MedSurg department of nursing. And talked with the IT folks who were the builders, and I could speak the language that the clinicians wanted when they developed the system. So I've been doing this for over 25 years. Going now for my doctorate so that I can more fun stuff.
And she'll jump in and answer any questions as we go through the presentation. But now I'd like to introduce you a co-student with you guys. He is in his final semester. He's working on his Bachelor of Science in Information Technology and goes to the University of South Carolina. I'd like Aiden to spend 3 or 4 minutes or less talking about his experience with his degree, as well as how he got an internship, any tips that he has, and what he does at the South Carolina Department of Mental Health. He's also accepted a position in May when he graduates with the South Carolina Department of Mental Health. This is Aiden Levy.
Well, and he said right over there. Right. So a little about what I do. I'm over on the networking department for DMH. So we work with all the switching, routing, Wi-Fi. When I first got there, we started a move to, if you're all familiar with the Hewlett Packard switching, so a lot of ruckus switches. We just got introduced to stacking. So we went through a good bit of stacking, and then slowly got introduced to our ticketing system, how that works. Communicating with system administrators and site administrators at different hospitals across South Carolina for like installation upgrades, troubleshooting network issues, and then slowly started transitioning to move to Cisco-based products. So I got to spend the second half of my internship going through and translating a lot of our configurations over to Cisco, because they don't line up perfectly, but it was more of just you're not doing one set thing while you're on the network department, except networking. You're taking one technology, how can we make it more effective, move it across 50 different sites needs, all while trying to communicate with the site what we're doing. So like, you're not going to go to a site, upgrade them, want it done, get the schedule in advance, make sure it works with the patient schedules, communicate effectively with the directors of the sites to make sure that you have the green card to go ahead and close down their site. So it's just a lot of communicating on top of doing the actual IT. And I have to say, my internship summer was probably my most fun summer at USC, which kind of sounds weird to say out loud, but I would say it was probably one of my better experiences here.
Excellent. Thank you very much, Aiden. We appreciate it.
So what do we do at the South Carolina Department of Mental Health? Our mission is to support the recovery of people with mental illness.
So this is a service industry, even though you may be working on the technology side, but like Aiden just got done explaining, you are continually communicating with the leadership because we are not the experts and we need to know what's going on. You need to know if that product or that change meets our needs. But you do have, there is a lot of communication involved, even if you're kind of behind the scenes. When it comes to mental illness, there's so much more to mental illness than I think that people realize or understand. That doesn't mean that you just have a diagnosis of schizophrenia or bipolar. It also means that we service people with autism, ADHD, depression, suicidal ideation. There's just so many aspects that we service. And a lot of times, many people have trouble at some point in time in their life and just need that support system, even especially if they don't have a support system of their own. So those are the types of patients that we deal with. South Carolina Department of Mental Health is one of the leading providers of mental health treatment in South Carolina. We have an inpatient and community services, and we treat adult, child and adolescent, forensics, geriatric patients, and we have substance and alcohol abuse as well. We provide service, I just mentioned substance and alcohol abuse. So we have 7 inpatient locations. We're across the entire state. Our headquarters is in Columbia, but we are across the state. We have 7 inpatient locations, meaning they're hospitals that run 24/7. We have 6 that are local, 1 that's in the upstate up in Anderson. We have 16 outpatient clinics across the state. I want to tell you a little bit more about those 16, a little bit about our electronic health services across the state. So Aiden was telling you a little bit more about, we have an IT side, and then we have the electronic health records, which Diane deals more with. But so our inpatients currently use Avatar. That is our electronic health system that we use. We are currently using a different electronic health system out in our 16 community clinics because sometimes different software meets different patient care needs, but we are converting, I believe in July is the goal for us. We are converting our outpatient clinics to the Avatar system as well. Now, it's going to be formatted differently and in order to meet their needs, but we do have 2 different electronic health systems currently. Keep that in mind. So one of the best things about working for a state agency, and there are several state agencies, and sometimes it can be confusing. If I ever send you a link or you look up jobs with the South Carolina Department of Mental Health, you might not be under just the South Carolina Department of Mental Health. You're going to see several state agencies. So if you apply for a job with the Department of Mental Health, I can help you. I can pull that application. I can get it to the hiring manager and help get it processed. But there's other state agencies. So if you apply with the South Carolina Department of Health, Health and Human Services, then that is actually a separate department from us. So I wouldn't have access to that application. But it doesn't matter what state organization you work with, state benefits are awesome. The only thing that I think that are better are federal benefits, to be honest. And I've worked in the private sector for years. So we have medical, vision, disability, paid vacation, paid sick leave, and a pension plan and a 401k. And nowadays, a lot of organizations do not have a pension plan. After 8 years, you're vested, and I think it's 28 years you get full retirement, depending on what your age is. The nice thing about us is we have 43 possible paid leave days per year. So you have 15 annual leave days to start with, possible 15 sick leave days, and 13 paid holidays when you work with any state organization. There are opportunities for career advancement, and we'll tell you a little bit about the different types of positions that we have in a minute. And then there's also opportunities for tuition assistance if funding is available in that department. Internships. We have our internships fluctuate, and we have a tremendous amount of students. So the further in advance you let us know, the greater chance you have of getting an internship with us. We are currently, because of several transitions, 1, changing that electronic healthcare system out in our community locations. 2, our central office, and Aiden can tell you more about this, is moving to a completely separate location out in Casey, which means, and I can't speak the language, y'all, but they're changing servers and streamlining processes, and they're revamping the system in order to support us as we transition into that new location. And then we've had some healthcare organizations out in our areas there have been some hackers out there recently. It hasn't affected us as much because we have an incredible security system, but they are busy with all these items. And like I said, these transitions. So they've asked to hold off for a few months on internships. But I have requested, and Aiden's going to help support us in this, I've requested that we get a group of capstone students together and trying to explain to them this would help support this change in process and be beneficial for the students. There are different types of internships and experiences that you can have depending on what your background is. We do have the information technology, and like I said, we're going to talk about different positions that we have available. And then we have those that work on the electronic health record. The electronic health record in some of our leadership positions, normally, just so that you know, if you want something related to electronic health record, not only do they have a health IT background, but a lot of them have a clinical background as well. So that clinician can help translate what I as a physician needs into how to change that process or make it through that electronic health system so that I can meet regulatory requirements. And I'll give you an example. We had an issue a few years back with one of our regulatory agencies, which is Joint Commission, comes in and says, you're not meeting the requirements for your suicidal assessments and prevention. And we have a zero suicide policy. And so our assessment wasn't good. So we had to change the policy. We had to change the assessment, and we had issues because this is all done electronically, and we have different disciplines doing different parts of this process. So the physician comes in, the social worker does an assessment in the electronic healthcare record. And how do I, as a nurse, know that assessment was positive for suicidal ideation? There has to be a flag, and that physician has to make an order. So that electronic healthcare system has to flag the appropriate disciplines to ensure they're completing their piece of that suicidal assessment, and that the nurse is doing a daily assessment, either 30 days if it was a moderate suicide assessment, and if it was severe, we do it for 90 days. Well, I, as a nurse, haven't, I don't know that they've tested positive necessarily. Maybe I wasn't in that huddle or that treatment team. So we had to get together with our IT department and the electronic health record, and we had to explain that I needed a flag and it needed to be where I saw it. So we created a window that popped up automatically. And then that apparently was not enough for us to get it done every day. That window had to change colors for me to know whether it was done today or not. So when it originally popped up, now it's red and it has the date on it that it's completed, and then after I've completed that assessment, it turns green and shows the next due date of that assessment. And there's still issues, as you guys know. We don't always know when our 30 days or our 90 days is up and it's time for us to reassess whether we need to update that order or not. So again, that's a continual communication with the clinical staff, and how can we meet their needs and those regulatory requirements by working on this system. And of course, anytime we put something in place, we monitor it. We monitor it for a 3 or 6 months period to see if we are compliant in that area, and if not, how can we change or update the electronic system to ensure that all the disciplines that are using that same tool know what's going on with that patient. I hope I explained that well. Information technology positions. These are some of the positions that we have. We have an IT business analyst, an application developer, a web developer. We have system and database administrators and database specialists. We have IT supervisor, IT manager, and an IT director. We have a systems engineer and data architects. And Aiden, do you have anything you want to add to that?
All right. I want to make sure that I covered it. Again, I am not the IT expert. What, did you have a question? What's that? Go ahead.
Like, you have to study at all during this interview, because I know like some interviews that you know,
So that's actually a very good question. I kind of got surprised with the interview. I sent a couple of emails and it's spring break, 23. And I got a call from, one of the directors of my department and she pretty much said, maybe 30 minutes from my interview, but we're saying, came home. I'm like, "Ooh, okay."
It normally doesn't happen like
Yeah,
that.
That was just one vote. I think that, you know, and I didn't look at my, very thing. But, I didn't do a whole lot of preparation, you know, outside of like what y'all be learning in this class. But once I started the position, there was a examination of, like your assessment on can you adapt and learn, like the different aspects of how their network is set up, for example. So that required about a 2 or 3 week period of studying, hitting the books, hitting the notes, reading the documentation, kind of learning it as fast as you could.
so that was after you on.
That was in my first 2 weeks there, so that was kind of a like make or break for yourself sort of moment.
Well, that's a great segue into the next part. Did somebody?
Depending on the next part, it may.
You want to wait? All right. Well, don't forget your question now. What do you know about interviewing or building a career? Well, let me tell you a little bit about interviewing because I've been at this for 37 years now. And I've been a hiring manager and I've hired literally hundreds of people. And one of the first things you want to do is do not be surprised if you have to apply for 70 jobs just to interview at 5. So keep that in mind. It is not about you. Sometimes they have postings that the positions have already been filled that they haven't pulled. Sometimes you don't meet exactly their qualifications, but be relentless in applying for jobs and don't assume that you've got one job until you solidly have accepted a position. Investigate the organization that you're interested in, and if possible, investigate the hiring manager. Ask who your hiring manager is. Ask for a job description so that you can speak to how you meet the requirements in that job description, and see if you can find out who your hiring manager is. Anything you can find out, it will help with the interview. Always look professional, because even if you're doing an online Teams interview, because they're looking for you represent that company. So I'm looking at, you know, are you going to be professional? And sometimes people are introverts, but it's really important in an interview. I'm going to talk to you long enough to find out what your work ethic is. Are you going to show up? Are you genuinely interested? Are you going to be customer oriented? You know, every interviewer is going to have different goals, but I want to know about what makes you you. Like, are you going to fit with my team? Are you going to, one of the quietest people I ever interviewed, I brought him on board and he was a radiology technician and he didn't talk to any of us at all. But I continually got customer service remarks about him, about how awesome he was and how much he put them at ease because he talked to them. So, and what I will do is if somebody doesn't talk to me, I'll keep talking to you till I find out more information. And if I'm putting you in a leadership level, I'll talk to you for at least an hour, because by then you'll put your guard down and you'll start telling me all kinds of crazy stuff. You know, I have trouble showing up for work Monday morning because I'm still drunk. Well, that is just not something you want to tell your interviewer people. So keep it professional. Those are some of the tips for your interview, but be prepared, be early, go early, because you don't know whether you're going to get caught in traffic, but it all matters. And you could have the same qualifications as someone else, but if you represent well, I'm going to hire you.
So, if there's one company that 15, 25, before the company that doesn't have in trouble, how would I find that?
Just Google them. Google them first. And then when they tell you that you, when they set you up for an interview, you ask, say, can you tell me, they should tell you, normally they tell you who you're interviewing with. Either that person's the one that contacts you, or and if HR is the one that contacts you, then ask them, who will be the hiring manager? Who am I interviewing with? And then go Google those people. I mean, I hadn't updated my LinkedIn for 5 years, and I just updated it the other day because I knew you guys were gonna stalk me. So, but not everybody's on LinkedIn, but Google, shoot, I Googled Aiden before I came here today to make sure I had the information on him correctly, and I did. So, but yeah, Google those hiring managers, find out as much as you can. I always ask for a job description, always, and I print that out and I keep that with me. I also prepare by, go online and look for interview questions to ask an employer. And then some of those they might already answer, but always have 3 or 4 interview questions, what is going to be, what are your goals for me in the first 3 to 6 months of this job? What is going to be the greatest challenge that I'm going to have when I start this job? But make sure that you ask those questions. It shows interest, it shows some knowledge of the subject. So that's an excellent thing to do.
Right, for my question was for Aiden, maybe a little bit, but I'm curious that the quality of onboarding you get into the job and the training that you put in.
So that's actually a very good question. When I started, I wasn't sure where to go. I had my badge and I went into the building and I went to my boss's door. I was actually sat down and for, I want to say 3/4 of my internship, I was constantly working with an actual network administrator. His name was Tariq Mitchell. He and I sat down about every day, and it started. I would shadow him, and he slowly introduced me to the process. And by I want to say like early July, he was having me pretty much drive the entire everything that he would do. He's like, all right, I want you to go. How would you solve this? Go ahead and do this. Go ahead. But it's not so much that if I got stuck, I didn't have resources to go to. And there were some places where me and I were stuck on an issue, like we were upgrading firmware, and it kept breaking this one specific device, and we didn't know where to go. So that started to become a little more collaborative. We would both look online, we did for documentation, and when we finally couldn't figure out anything, we decided to best to call our vendor. So my training, so to speak, was about a month and a half of working one-on-one with one of the actual employees.
Ideally, your organization will have an onboarding process, and ideally they will put you with a good preceptor. That does not always happen, so ask questions. If you don't know what's going on, if you don't have somebody that you're really understanding the process and what your job role is, ask questions. Just keep asking questions. I can't stress that enough. Nuggets of wisdom. First thing is, don't limit yourself. Don't limit yourself according to what some professor said about you 2 or 3 years ago when you didn't think you could write a paper. Don't limit yourself about what somebody or family member in your life said about you when you were in high school. Don't limit yourself. Don't think you're not good enough. Don't think you can't do it. I would have never thought that I would have went for my doctorate. And I had a teacher when I was in 11th grade in high school who told me that I was never going to write a paper. And I have a paper, and I've always been able to write papers. And I have a scholarly article right now that's under consideration for publication for adolescent depression screening in the public schools. So don't let what somebody else says limit you in any way. Don't get in your head. You can do it, and get a cheerleading section around you if you can. Grab every opportunity for experiences. So if you can go to different places in shadow, whatever you can, like I said, if you were like in the medical field, I'd tell you, try to hang out with a rad tech, hang out with a doctor, hang out with a surgical tech, hang out with a nurse, hang out with somebody in pharmacy. So in other words, go to different places and locations, talk to different people, ask them what their job is like so that you can find out exactly where best fits you and where you'd like to have an internship at. Prepare. We talked about how to prepare for an interview. Work ethic and attitude are important. And I'm gonna tell you right now, you can have all the same qualifications as somebody else, but if you're the one that shows up, works hard, is innovative,
You are reliable. I can count on you. You're honest. You have integrity. One, I'm going to give you the job over somebody else. And two, I'm going to move you up before somebody else that doesn't have those qualities. And you might not even last if you don't have those qualities. That means you got to be there. You got to be there on time. I got to be able to count on you. You got to be able to problem solve, and especially in your type of roles. Other thing is ask. I told you already to ask questions. The other thing is at some point when you have proved your worth, ask for a raise. Most of the time, people are not going to come to you and say, here, I just want to give you more money. You got to be able to ask. It's one of the most important things that somebody in HR actually told me at one point in time is ask for a raise. Say, I've done this, this, and this, and I'd like a comparable raise. Except that you have to start at an entry level or lower than desired pay. Just accept that. You'll move up, you'll make the money, it'll work out, show your worth, it'll happen, but you got to get your foot in the door. And sometimes you got to do something different that you're not exactly, it's not exactly the most fun or the best thing before you get to where you need to be. My son graduated from in chemical engineering from the University of South Carolina, and he was a waiter at first, and because he didn't have experience. And so for the first year or so, he was a waiter. He finally got his foot in the door somewhere, only making $14 an hour on night shift, working basically 24/7, helped put the plant together and put stickers on the plant. That lasted about 2 years. Once he had that experience, paid his dues, he went to a great organization and has continued to move up and is a lead and engineer at this point in time. In fact, he's recently moved into, which he's really enjoying and you guys can relate to. He went from chemical engineering to control engineering, which is a lot more on the computer now. And he's absolutely loving it. But it's a process. You have to stick with it. You got to show your worth. You got to keep working at it. I didn't start out where I'm at now, let me tell you. Strive for that work-life balance. I'm terrible at this. Don't be like that. It's good to work really hard, but make sure that you have got a social life, a family life, and that work-life balance as best you can. Teamwork, have a good relationship with others, especially those that you are working with. You are spending a lot of time in this work environment, so be kind, have integrity, do your best, and treat others with respect and kindness, no matter how you feel about them. Because if you keep treating them that way, they'll change and they'll start showing you that same consideration. Just don't take things personally and just be kind to everybody. So, in conclusion, healthcare is a service industry, as we've mentioned. And so you are providing a service, not just a behind the scenes information technology. And healthcare workers, if you want to consider a career, anything related to healthcare, which there are so many different healthcare organizations. There's radiology, there's doctor's offices, there's dental, you name it. But if you want something in healthcare workers, I do believe are heroes. And everything that you do in the IT department for the South Carolina Department of Mental Health, everything that you do goes all the way back to the patient. I, as a nurse, cannot take care of that patient if I cannot access that information, if I don't know what their allergies are, if I don't have the correct medications. We use scanners for our medications. So we do have several different things in our organization that tie into the IT system. I, as a nurse, we have a Pyxa system that dispenses our medications. That is also tied to our electronic health record. We have a scanner to scan medications to show that you've given the medication to the patient and the correct medication. So we like I said, we use a lot of technology. You have anything else that you would like to add? But I can't say enough. If you can't work for the South Carolina Department of Mental Health, being in a healthcare organization is fantastic. You guys are going to an excellent school that will prepare you for everything that you need. Thank you so much for your time. We do have some information up here. I have time for questions. Everybody take one item off the table. And I have some cards up here too. If you do apply for a position, if you call, email, or text, I will pull your application, get it to the hiring manager. We'll help get you in there. Anybody have any other questions?
On that card up there, your email information.
My email information is on the card up there, and if you don't want to take the card, just take a picture of it.